Today is actually International Suicide Prevention Day, and we've got some wonderful ladies joining us this morning to talk about what's being done here in the city and some resources that are available not only for the kids but also for the parents. Joining us is Terry Murray from Crossroads Children's. You're the executive director there at the center. Welcome to the show. And Phyllis Grant-Parker, who's with Parents LIFELINE of Eastern Ontario, which is a wonderful organization and doing some great things. If I can come to you, Terry, first. What does this day encompass? What are we looking at here in the city and the day in general?
Ottawa is a very caring community, and about 3 years ago, about 50 organizations and families came together to create a community suicide prevention network. And the whole purpose is to collaborate and put our resources together to make Ottawa a suicide safer community. And one of the important initiatives that came out of that is a lifeline for parents and a helpline so that they can navigate the system, they can get help, and they can get support. And that came about because of some very hard work, and a lot of volunteers from families and also the service providers worked hard, but the generous support also of United Way and the Champlain Local Health Integration Network funded that.
You know, there's been so much dialogue and discussion, at least we're talking about it, but it's interesting to see that there's so much being done for the children and there are resources available, but where do you go and where do you seek the help? Because sometimes, and I know in the last couple of years, it didn't all quite fit together, and that's where you guys come in, because you really offer that peer support for parents to call and say, this is what we're going through, what happens now?
That's right, and with our new helpline, I mean, PLEO has been around since 2000 supporting families. So we support the families, the parents of children, youth, and young adults living with mental health challenges. But a year ago today, it was exciting. We launched this new service, the Parents Helpline. And what it is we have parents there, we call them family navigators, and they themselves are parents who have lived experience supporting their own child. So they've navigated the mental health system, they've been there, so they get it. And so a parent can pick up the phone, call the helpline, and talk to someone who instantly understands what they're going through. And then one of the major purposes is to help them understand, the caller, the parent, to understand exactly the services that are out there. You know, and often people think just of the names that we know, but there's other resources within the community.
Well, that, I think what's surprising is that, you know, if unfortunately parents find themselves in a situation where their children have been through CHEO or have gone through certain care, once they're discharged, it's where do we go for additional services? Where do we keep the help coming through? And so they are, as you mentioned, a number of them. It's putting it all together. What has the reaction been like for parents on both sides, those taking the calls and those making the calls, to actually have it similar of parents talking about this rather than a kid calling a helpline?
Well, I think that the parents who are our navigators, who we've hired to actually take the calls, they're finding it extremely rewarding. I mean, to be able to give back, they're very caring parents themselves. And we do surveys with the parents. We've, in the first year, we've helped over 300 parents to help navigate the system through our helpline. And the surveys with them, over 85% have said that it helped them to reduce their stress as soon as they called. If you're on the call, you can just hear people's anxiety units go down, and also that they feel better equipped to support their child. I think one of the really important things here is that we know from research that youth who have good family support have best outcomes. However, the question is who supports the supporters? That even though in Ottawa is doing amazing with our conversations about mental health and about suicide, but the reality is there still is stigma. So families often find themselves very isolated. Even well-meaning, well-caring family and friends don't always get it. So this means that they can call someone, and they can call as often as they want, and it's a confidential service. So
it's part of the things we are learning about on this International Suicide Prevention Day, Crossroads Children's Center. We know that that exists, and Terry, thanks for that. Please, if you have if you're looking for information, PLEO, so it's the Parents Line of Eastern Ontario.on.ca. If you want to make that call, and you will be able to speak with someone who's probably got that lending ear that you've been looking for. Thank you, ladies, so much for joining us.